Hey guys, in this lesson we are going to be talking about the pediatric cancer that's called nephroblastoma, or sometimes you may hear it referred to as Wilms tumor. So nephroblastoma is the most common renal tumor that's seen in children less than 5 years of age. And what we mean by renal tumor is that it stems from those embryonic renal cells. So the tumor can actually be found in other places. So if it's metastasized, it can be found in the lungs. It's most commonly found on the kidney, but it comes from those early renal cells. And diagnosis usually peaks between 2 and 3 years of age. If this is diagnosed, treatment is going to be surgical, and that is going to be followed by chemotherapy and radiation. And one thing that's really great about this tumor, if you can have something that's great about a tumor, is that it's really responsive to treatment. And if the tumor is localized and only in one place, there's actually a 90% cure rate, which is pretty amazing. So the first symptom, and sometimes the only symptom that's associated with the nephroblastoma, is an abdominal mass. And on palpation, this mass is usually non-tender. It's confined to one side of the body. So it's either found on the left or the right. It doesn't usually cross the midline. And it's usually quite deep on palpation. The left kidney is affected more often than the right kidney, and most of the time it's actually discovered by a parent, either while they're bathing or dressing their child. And usually, like I said, there aren't necessarily any other noticeable symptoms, but sometimes the tumor can be pressing on the kidney, and that can cause hematuria. And you may also see that a child is anemic, and the anemia would be because there's bleeding occurring inside the tumor. Now, this tumor is found on, it's attached in part of the kidney here. And one thing that can happen to be on the lookout for is that you can see blood pressure changes. And these blood pressure changes are occurring because you have these additional renal cells that are found on the tumor, and they are over-secreting adrenal hormones, and that can cause the blood pressure to go up. And that adrenal hormone that would be causing that would be renin. Therapeutic management of Wilms tumor is most often going to start with surgery. Sometimes if it's spread to other locations, or if it's affecting both kidneys, they may start with chemotherapy to shrink the tumor, but most of the time they're going to start with surgical removal. And what's going to happen is not only the tumor, but also the affected kidney and the adrenal gland are all going to be removed. And this is called a nephrectomy. And after that, they're going to be starting chemotherapy and radiation. Now, one thing to note is that treatment usually starts 24 to 48 hours after they've found this abdominal mass. So that's really, really fast. Within 2 days of finding the tumor, the child is in surgery to have it removed. And this just means that there isn't much time for families to process what's happening. And honestly, these parents almost always look like deer in headlights. They're trying to process everything that's happening, and it's just overwhelming. So make sure that you're there to provide support and educate them, and clarify any questions they have after the physicians have educated. Just be around to help them process that. Nursing-wise, you want to make sure that no one palpates the abdomen. Now, there's a really important reason for this. It's so important that it's worth putting a sign over the bed just to make sure that it doesn't happen. And it's because these tumors are usually encapsulated, which just basically means that all of those cancer cells are being held in place, and they aren't spreading all over the body. If the tumor is moved around, experiences some kind of trauma, then it can actually break open that capsule, and that will spread all of those cancer cells throughout the abdominal cavity, which I don't have to explain why that's terrible. So this means that baths and patient movements, every time we're handling this patient, we need to make sure that we're doing it very, very gently. Another thing to monitor in the pre-op period is to make sure we're keeping an eye on that blood pressure. Remember I mentioned that the extra renal cells can be secreting renin, extra renin, which can cause the blood pressure to go up. After surgery, you're going to be wanting to do most things that you would be thinking about for any major abdominal surgery. So you're going to be monitoring bowel function, assessing urine output, monitoring their pain, all those things that we would normally be looking out for. And remember, they've also lost a kidney, so we really have to monitor very, very strictly how much they're peeing. And for most young kids, this means that we're going to be weighing their diapers. And when you weigh diapers, just remember that 1 gram of weight is pretty much equal to 1 ml. So just make sure that when you get this number that you subtract the weight of a dry diaper to get an accurate amount. After surgery, the patient is going to go and have chemotherapy and radiation. And your nursing interventions for these two things is going to be very, very similar to those that we discussed in the pediatric leukemia lesson. So make sure you listen to that one if you need a refresher on some of those things. Remember, I mentioned this tumor is just really responsive to treatment. So there's a 90% cure rate, which is amazing. But these kids do still have to be monitored really closely for the rest of their lives for complications that are associated with treatment and also for relapse. Okay, so if you are providing care to a pediatric patient with a nephroblastoma, your priority nursing concepts are going to be cellular regulation, elimination, and comfort. All right, you guys, that's it for our lesson on nephroblastoma. You can see this is a pretty straightforward lesson, and the nursing care is pretty straightforward. It does overlap a lot with your other lessons on cancer, so do make sure that you refresh on your nursing care for chemotherapy and radiation if you need to. So your major takeaway points for this lesson are, number 1, knowing that the tumor is growing from renal cells, and it's usually found on a kidney in kids ages 2 to 5 years. Number 2, the first and sometimes the only symptom is an abdominal mass. Remember, this mass is encapsulated, which is preventing the cancer from spreading, so no one should be palpating that abdomen. Number 3, treatment usually starts with a nephrectomy, which is removal of the tumor, the kidney, and the adrenal gland, and it's a major abdominal surgery. So these patients need to be monitored really, really closely for those standard post-op complications like bowel function to make sure that they're not having an obstruction. And we also need to be monitoring their kidney function. Remember, they only have 1 kidney now, so we're paying really close attention to that blood pressure and the urine output. And that's it for our lesson on care for the pediatric patient with nephroblastoma. Make sure you check out all of the resources that we have attached to this lesson. Now go out and be your best self today, and happy nursing.